you need the irrigation kit. You need a bucket. All these stations, these are in the bedside table, so help yourself to one. You need your NG tube. You need a cup and a straw, gloves, a towel or something to put on the patient. Fake pH strip, mannequin lubricant, but you will verbalize using regular lubricant. You won't necessarily use that on the mannequins. Gloves. All right, this is asking me stuff. Okay, so knock, knock, knock. Sanitize as I come in. Sanitizer in my eye. Introduce myself to the patient. Hi, sir. My name's Jocelyn, and we got an order to put an NG tube down you today. You're super nauseous. You've been throwing up a lot, and we want to kind of make you more comfortable. And so this NG tube is going to go through your nose and into your stomach, and it will help remove some of that secretions and such that's coming up, relieve the pressure on your stomach, and help you feel better and let your GI system rest a little. Have you ever had this done? No. Do you have any problems with your sinuses? Have you had any nose surgery or, you know, broken nose or anything like that? He says no. If I haven't yet, I'm going to go ahead and confirm his ID against my orders, which they match just right, name and date of birth. I'm going to look around and make sure that I've got suction on the wall and tubing connected for that. And generally, you've got the green, the yellow, and the red, right, on your suction. Usually we use what's called low intermittent, so that's usually in the green zone. And this one has a fake intermittent. The little switch goes back and forth, and on most hospital ones will go over to intermittent. And so that is that's used because that also helps prevent trauma. So it's not continuously sucking. It sucks and then stops. So you'll see this little guy go. If it's working, it'll go up and then go down, and up and then down. And then of course you'll see the canister also fill up with stuff. All right. So in this case, I meant to grab a ponytail holder today. Do you need one? I think I have one in my jacket. Sorry. I grabbed it particularly when I walked out the door because I was like, I'm going to do a skill. I got to put my hair back. Sorry, guys. OCD. Here it is. All right. So, I want to lead by example. So, put my hair back. Besides, if he throws up, I don't want it in my hair. All right, so supplies are ready. I'm going to go ahead and get him in a good position. Probably put his head up a little bit more. The light going on here. I'm going to go ahead and take down the rail so I can get close and do this. Put a towel down in case we have any unexpected, untoward occurrences. I don't really need my gloves quite yet. Going to, and in this one you're going to have an assistant, and so in a minute I'm going to have somebody, if you guys want to move that out of the way, somebody can be my assistant on this side of the bed to hold the cup and straw. Thank you. Get my NG tube out and measure from the nose to the ear down to the xiphoid process, which is about, you got to kind of get through the gown on a person, right about here on the mannequin. So, down to the xiphoid process, dink. And then what I usually do is, if I have my tape with me, I forgot. I have a securing device. There, we'll tape over there on the cart behind you. It's really better to use a Sharpie because you can see it later and it's not irritating, but for the sake of practice, you can just put a little piece of tape on there. If there is any. There we go. Just put a little piece of tape at your spot so that way you can remember where it's going to go. So we're right here at 65. But like I said, a marker is a better idea because that's not going to be as uncomfortable. So I've got it marked. The first thing I want to do is also pull some air into this and connect it. And the other thing I want to do is connect this to the suction right away. So the minute I take it off, I want to put this over here because this little guy gets lost quick. He's like got legs. You take him out and next thing you know, you can't find him and he's crucial. So I put this on here first and I make sure this is on here so that way, once I have this in the stomach, nothing aspirates kind of back through. This blocks the end for me, because otherwise it will leak. It can leak if there's pressure. So that's ready. That's ready. Put some gloves on. Suction tubing has a mind of its own. Put some gloves on. I've got my little pH paper in the bucket here. I'm going to hold the bucket here in case he needs it. Usually they don't really throw up, but in case they feel like it. Who wants to be my assistant? So what you're going to do for me is when we get to a certain point in the process, we're going to ask him to take sips of water and swallow. Okay, and I'll let you know when that is. So, so at this point, we're about ready to put the tube in. I'm going to lubricate a little bit, and we're going to go ahead and start. And at first, he's going to kind of lean his head back, and then once we kind of get past the nasal pharynx, we want to put his chin forward. That helps close off the trachea a little bit, right, and helps it pass into the esophagus, and that's usually when we'll have him swallow too. So I ask him if he's got a nair that might be more plugged up than the other or anything like that. Use the one that's more open for comfort, and start, like I said, again, I'll kind of go in straight back, and it'll sort of hit the back of his throat right about here and be like whatever, and we'll have him lean forward and take sips of water. Swallow, swallow, keep swallowing, swallow, 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 and you want to be quick as you push it in. Swallow, 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 swallow. Keep swallowing, keep swallowing, keep swallowing, keep swallowing. Okay, all right, good. Now if you could just hold that in place for me. I put my stethoscope on, right? And the first thing I'm gonna do is put it right here, through the, not through the shirt, but under the shirt, against his stomach, where I think his stomach would be, and push this guy in. And you're gonna hear some bubbles. Now this is not the gold standard, but you still see it done. Then I'm gonna go ahead, if that worked and I hear bubbles, take my stethoscope off, pull back. I should see some stomach-like secretions here, right? It might be, he might have coffee grounds, he might be green, it might be yellow, but it should be something, and it should be a good amount. And I'm gonna go ahead and keep this covered, squirt that on my pH strip if I'm using that method, and the pH strip will confirm that it's in the stomach. So I will go ahead and connect, and then I will tape him in place. And I will do the little thing where you tear it down the middle. I think you guys even have NG tube securing devices too. Put it over the nose, and then wrap it around. I don't know if this foam tape will hold on the mannequin, but on a person. And so then you've got it on there nice and secure. And at this point, if you want to, some people will take a little rubber band and put it, like, you know, loop it through here and pin it to his gown so that he can move his head, but it doesn't pull. But you want to make sure it's secured next to him and not going, he can turn his head, you know, back and forth too. And then at this point, I'm going to just take a look at what's coming out, and it should be what I expect here. I'll take that back, thank you. If he's coming in with a GI bleed, I should maybe see some coffee ground drainage or greenish, bile-ish, whatever. Come back in about 15 minutes to assess the full output and see what was in there. Go ahead and document the procedure, and that includes the type of tube, Salem sump tube with the 14 French size, the nair that it's in, right or left. If I did use any lidocaine gel or anything, so when I sprayed, that was my lubrication stage, but if I had lidocaine jelly, whatever, I'd want to document that. The output, how the patient tolerated it, any issues, and then my confirmation methods. So I confirmed a couple ways. I listened for air, I aspirated for gastric secretions, I also assessed that he could talk and he wasn't in any respiratory distress. If I put it in and he looks like he's turning blue, or his sats start to drop, or he starts coughing uncontrollably, or can't talk to me, I'm going to just pull it out and start over, because there's a risk that it went in his airway, and I don't want that. So that is NG tube. Any questions? It's pretty quick. Really doesn't take a lot of time. So we'll segue right into